Hi, today we have Dr. Shantaram with us from Chennai, who is a diabetologist and he's been practicing for the past 36 years. Hi, Dr. Shantaram.
Hi.
Doctor, this one question I want to ask you. Why is it that most women develop insulin resistance when they reach the menopausal stage?
This is a very, very important and relevant topic, especially for women's health.
Yes.
The relationship between diabetes, which is the biggest health tsunami of the century, and menopause, which marks the end of the reproductive life of the women, as a bidirectional relationship. Menopause increases the risk factors for diabetes
Yes.
and precipitates diabetes in potential diabetics. Those who have not had diabetes but who are prone to develop diabetes, like with the family history, obesity, and all this, it precipitates. Not only it precipitates diabetes, in a known diabetic, it offsets the glycemic control in the post-menopausal state because of the hormonal fluctuations. Similarly, diabetes increases the menopause predilection, means what do you say? It precipitates menopause at an earlier age, what is called the premenopause or early menopause.
Yes. Okay.
And that has implications for the women's health because postmenopausal women normally have osteoporosis, increases of cardiovascular disease, so on and so forth. And coming back to your question, why insulin resistance? It is multifactorial. One is hormonal. Estrogen starts decreasing, not at menopause. This is a perimenopausal state, which is 8 to 10 years before the onset of menopause. It starts decreasing. That insulin, that estrogen has got effect on the other hormones also, like GLP and all those things. And the reducing estrogen level increases the insulin resistance. And second, as you approach menopause, your body shape changes and there's a redistribution of fat into the visceral compartment that is in the mid part of the abdomen from the
Yes.
thighs and gluteal region to there. And that creates more of insulin resistance,
Oh,
the redistribution of fat.
correct. Yeah, it's predominantly around the belly
Yeah.
area.
And last, the symptoms associated with menopause, like the disturbed sleep, they can also increase the risk factor for diabetes.
Interesting. Doctor, could lifestyle changes now explain why there is more diabetes around us versus 30 to 40 years ago?
Of course, see, genetic background is always there, but this phenomenal increases because of the changes in the lifestyle. See, our genes were not adapted to the abundance. So we are hunter gatherers earlier.
Yes.
So our genes were tuned to save energy for the famine. But now there is no famine. Now we have everything plenty in excess. That is compounded by the lack of activity. So it is mainly the lack of physical activity resulting in obesity. Two, the dietary indiscretion, eating not only unhealthy foods but also in the wrong times,
Correct.
disturbed sleep, increased stress, mental stress. See, earlier we do work at a time and we focus on that work. Now, as we are doing this work, we'll be thinking about other work. And now with the targets, so most of the software people see earlier, we never used to see heart attacks in 20, 30 years. Now people undergoing bypass in 20, 30. It is not because of diabetes or blood pressure or cholesterol. It is the disturbed in the
Stress.
biological sleep rhythm compounded by the stress what these people undergo to finish, to have the targets within a time frame. So these things were not there earlier. So imagine our grandfathers' days when they do the work, they walk everywhere. So now we don't even go to the provision store by walk. We take
Everything.
scooter or something and go.
No, now we have
I
big
can
basket.
recollect one thing. See, when I was school child, my mother used to grind the thing for idli and dosa. Then after a few years, we had a community grinders where you used to walk and grind and come stand in the queue. Some physical activity had. Then the mixies came into the house. So we don't walk and go. It was done in the mixie. Then later it evolved into a departmental store ready-made powders. And the ready-made powders, restaurants have come up now. See, for example, when I used to go and study in Anandnagar during my exam days, we had only two restaurants in Anandnagar way back in 1975 77.
Wow.
But now my street has got five restaurants. Earlier, we used to go to the restaurants to buy and come. Now, these people order on the Swiggy and this thing. Even that exercise is lost. And
Yes.
that time we had a time frame where we had to eat. Hotels closed by 9 o'clock. Now, 1 o'clock, 12 o'clock, everything is available. This is a sort of change which has precipitated obesity that is resulting in diabetes, hypertension, cholesterol, everything.
Yes. And with all the equipments at
And
home.
that not only that one, see also now it's combined with vitamin D deficiencies. When the vitamin D levels are not good, what insulin is there in the body will not act to what you call as insulin resistance.
Mm.
We think that only the office workers are having vitamin D. No, I had seen among the field workers. That means
Oh,
it is not only the non-exposed to sunlight that is important. Maybe the insecticide and pesticides in the food what we grow should have an effect on the vitamin D levels. Vitamin D is very important for immune function, for your insulin sensitivity, bone health, everything.
doctor, how can a woman going through menopause tell the difference whether she's diabetic, whether she's having some blood sugar swings, or whether it is menopausal symptoms? Because
Yeah,
sometimes we suddenly start sweating, we feel tired, then there are some hot flashes. But I heard that even with diabetes, you have somewhat similar kind of reactions in the body. So, how does one get to know?
exactly. Very important. And that's why it's in treating a disease, what is more important is educating the patient first.
Yes.
That is the center of the table. Whatever you do are the pillars. The center is the education. Unless they know what it is, what to do, and how to do it, medication is not going to be as successful as it should be. So you ask a question, how do they differentiate? Yes, there are certain symptoms of menopause like sweating,
Yes.
palpitation, giddiness, which will mimic the low sugar symptoms. There are certain symptoms of menopause like fatigability, recurrent urinary tract infections, which may make a high sugar. So they should know whether it is due to menopause or due to low sugar or high sugar. If they don't know it is not due to menopause, okay, no immediate effect. But on the contrary, if they miss the low sugar symptoms, mistake it for a menopause symptoms, they can have an irreversible brain damage due to prolonged hypoglycemia because glucose is the fuel for the brain cells. Similarly, if you do not recognize the high sugar symptoms and mistake it for a menopausal symptoms, you can go into a metabolic decompensation where you can result in ketogenesis or hyperosmolar state, which may again impair the brain function. So it's very, very important. So the sweating in menopause, following sweating, they may be feeling warm. Normally, when you sweat, you may feel cold. In hypoglycemic sweating, it will be there. Coldness. After
Oh,
the sweating, you will have cold.
yeah.
And hypoglycemia setting will improve with glucose or some food, whatever you take.
Mm.
You will not have precipitating factors in a menopausal sweating like in low sugar sweating. So if you don't eat on time, you can develop low sugar. If there is a mismatch between the food what you take and the drug what you have taken, you can have low sugar. Or if you do not monitor on a sick day,
Mm.
you can develop low sugar. But these sort of precipitating factors will not be there.
Mm.
They do develop all of a sudden.
Yeah.
And similarly, high sugar symptoms,
Mm.
the recurrent urinary tract infection, fatigability, and all these things.
Mm.
In diabetic high sugar, you will have osmotic symptoms like increased thirst, increased hunger, dehydration, which may not have in the menopausal
Yeah.
the fatigability.
Mm.
So that way we have to teach them what are the symptoms of high sugar, what are the symptoms of low sugar,
Low sugar.
what relieves it, what precipitates it, so they can correlate with the symptom and then decide whether it is due to menopause or due to low sugar, high sugar. If it is low sugar, nothing, you have to eat sugar and take a complex carb and keep it.
Mm.
If it is high sugar, then you have to consult your doctor for
Mm.
titrating the drugs.
So, how often do you think a woman should get herself checked, especially when she reaches 40, doctor? for blood sugar levels, or be it any, a full health checkup?
See, as in, if I was talking about diabetes, apart from the other things, as a ethnic group, we are more prone to develop diabetes. Indians are more prone to develop diabetes at a much younger age than the Caucasians. So, anybody of the age of 30, above the age of 30,
Okay, 30.
should have an annual checkup to detect diabetes, to detect blood pressure, to detect cholesterol, be developed at a very early age. And all the disorders are treated not for today's problem, to prevent problem in future which could potentially occur after 10 or 15 years of diabetes or blood pressure or cholesterol, because these are all blood vessel disorders. Once you do not control, it will affect the blood vessels. And affecting the blood vessels in India too will not manifest symptoms. It takes years. They can become narrow, blocks can develop, the blood supply get compromised, resulting in the solid organ damage. And intervening at the time is not going to reverse the damage. Only thing you can slow down the progression of the disorder. Not even you can stop. You can only slow down. That's why, as a ethnic group, Indians should above the age of 30 should have annual check to detect. So if you detect early, because they are all asymptomatic disorders, not like asthma, you have symptoms. Sugar, you can have 4 and 5, still you cannot have, you don't have symptoms. Only in type 1 diabetics, they have symptoms. But the rest of the 95% type 2 diabetics, they may not have symptoms even the sugar is 300, 400.
So they just don't know.
See, once I had a patient sugar of 1500,
Oh my.
not knowing that he's a diabetic, he had come for some other problem. Sugar was checked up and it was 1500. So, early checkup is a must. And once you are a diabetic, if you are under control, once in 3 months at least you should have a regular sugar checkup, annual checkup to screen for the target organs, the eyes, the kidneys, heart, nerves, you should check it up. And also look for the comorbidities like blood pressure and cholesterol. Diabetics, even if they do not have cholesterol or BP, they are prone to develop than a non-diabetic. So you have to restrict your salt even though they don't have BP. You have to cut down on the fatty items, oily foods even if they don't have cholesterol much before they develop, because insulin resistance is the common denominator for all diabetes, blood pressure and cholesterol. So once you develop one component of the insulin resistance, you are prone to develop other components. If you restrict, either we can postpone the onset of those disorders or prevent those disorders.
Interesting. Dr. Shantaram, how does diabetes raise your risk of heart disease? Also, given the fact that they say when you hit menopause, you are, prone to some cardiovascular issues as well. So, what is the link between diabetes and heart disease, and how should a woman take care of this?
Yeah.
Because they say woman is more prone to heart disorders, especially when she hits menopause.
Yeah. It's a very good question. Diabetes and heart is a very interesting topic. Patients with diabetes are 3 to 4 folds at increased risk of heart disease.
Oh,
Not only they are at increased risk, they develop much early. Not only they develop early, what they develop is severe heart disease when compared to non-diabetics. So diabetes can affect the heart in many ways. One, the coronary arteries, what you call as the heart attacks, Michael. Two, it can damage the muscles, resulting in heart failure. So, and similarly, the mortality in diabetics is very high when compared to non-diabetics. It is very interesting to note that the premenopausal period, women are protected from heart disease to a certain extent because of the estrogen.
yes.
But when women develops diabetes, that protection is lost. They
Wow.
are as prone as males. That is why the post-menopausal women are at more risk of developing heart disease than the premenopausal, because estrogen goes down.
Yes.
And once a women develops a heart disease, the mortality is much higher than the male because of the falling estrogen. But the androgen keeps secreting a small amount of androgens. The alteration of the ratio increases the mortality in women heart patients. So it is more important for women to prevent heart disease than men to prevent the heart disease. So the general measures are, first, they should not put on weight. They should maintain ideal body. Especially, see, we are going, I'm not going with BMI. I'm talking about the central obesity. which
Belly
is the
fat.
culprit. That
Yeah.
is the culprit.
Mm.
Second thing, they should have regular physical activity, exercise,
Mm.
both aerobics for the cardiovascular as well as the muscle strengthening exercise to improve the insulin resistance, because insulin resistance is the common denominator for blood pressure, cholesterol, diabetes, and heart disease. So the muscle strengthening is also equally important.
Mm.
Plus, you should have yoga for the mind component.
Yeah.
So if you combine all these three exercises, that physical exercise will help you to prevent the heart disease. First is obesity, then the third is your diet. That is very important. See, if you are obese, you have to take a low calorie diet to lose weight. And if you are the post menopausal, I won't say low calorie diet, but a low carb diet.
Mm.
That will improve the estrogen effect. Low carb diet.
And increase some protein.
Protein, yeah. Instead of, if you restrict the calories, you may have fatigability and all.
Mm.
Don't restrict calories.
Yeah.
See, normally, see, we say 55% to 60% carbohydrates, remaining 40% from the proteins and this thing. And we don't want a very high protein diet right from the beginning, because it is not good for the good on the kidneys on long term. Very high protein diet. Similarly, high fat diet may not be good on the heart in the long term. But in a post menopausal woman, it's the duration is not going to be that much. So you can shift to a lower carb diet and increase the proteins.
Proteins. Okay.
That is, the diet is very important. Then, as he told you, sleep.
Yeah.
So less than 5 hours of sleep, your sympathetic system, that is stress system, gets activated. So you throw in hormones like catecholamines, cortisol, which not only derails your sugar, blood pressure, but is also bad on the blood vessels. So there's increased risk of vascular disease when the sleep is disturbed. And people may say, sir, I am sleeping at 12 o'clock, I am getting 8 hours sleep. So you are disturbing the biological rhythm. You should
Correct.
go bed good early, 10 o'clock at the maximum latest, and get up by 6, 7. That is a good quality sleep.
Yes.
And once again, with increase in obesity, you can may have the quantity of sleep. The quality of sleep is also very important. There are people where their gas exchange is not good, especially obese people, the snorers. So they should undergo the sleep study, find out what is happening in the night, how the gas exchange takes place, and correct it to have a better health. Then last but not the least, the stress. So these
Every.
are very important to prevent or reduce the incidence of heart disease in women.
Dr. Shantaram, of late, I've been noticing that there is a lot of hype around HRT treatment, the hormone replacement treatment for women who are going through menopause. And I'm just seeing that it's just very casually, very generic. They're saying, any woman going through menopause, just take it so that, you don't have to go through hot flashes and all the other several symptoms of menopause. What do you feel about this, doctor? Can you just throw some light on this?
Yeah, sure. This is very, very relevant in today's world.
Quick
H,
fixes they want.
HRT is both the devil and angel for women with menopause. We have got the benefits, we have got the side effects.
Mm-hmm.
The benefits are reduce the risk of osteoporosis, improves the bone health,
Mm-hmm.
reduce the risk of heart disease, it reduces the risk of cognitive impairment, and also reduce the risk of diabetes or the glucose intolerance. But on the flip side of it,
Yeah.
if it is given to a wrong person, it can increase the risk of cancer, especially the breast, ovaries, and the uterus. It can precipitate stroke in a person with a clotting tendency. And as I told you earlier, it prevents heart disease, can also increase the risk of heart disease, especially if you give it to women 10 years after menopause. So one should know when to start, whom they should start, how long they should continue, and how it should be started. It is better to give if the women attain menopause much before the age of 45 or 40, what we call as the premenopause or early menopause.
Yeah.
They benefit much because the post-menopausal women are at risk of bone disease, cognitive impairment, increased risk of heart disease. They benefit. So you have to start low and give it for 4 or 5 years, not permanently.
Okay.
And what type of pill you are going to give or the patch you are going to give, it depends on whether the person has uterus or not. It is not going to be the same for person with uterus and without uterus. Person without uterus you will give estrogen.
Hmm.
Person with uterus, you have to give the combined pill. Otherwise, estrogen will have an effect which can turn into a cancer of the uterus later on.
Oh my.
So you should know which person to give, what to give, when to give. And if you want to give the same HRT in a menopausal woman, 10 years of the menopause, it is not going to benefit, it is going to affect the health of the woman,
It causes damage.
causes damage. So it's both an angel as well as the devil. Only thing, the person who is giving should make it an angel and not a devil
For the patient.
for the
Oh, for the,
patient.
yeah. Okay. So I've heard a lot of talk around HRT. If you use it for a long period of time, that it can cause cancer.
Yeah, see,
It's one of
especially,
the side effects.
especially these organs, ovaries,
Mhm.
breast, uterus are organs commonly affected. And it also prevents one cancer. There's reduced incidence of colorectal cancer if you give a hormonal replacement therapy. Colorectal cancers are reduced.
Oh, okay.
So you should know which sort of patient you should give. Somebody has got a family history of colorectal cancers. They may benefit to a certain extent. Somebody has breast cancer in the family. I don't advise them to take HRT because there are other measures to control your hot flushes, night sweats, non-hormonal measures are there.
Correct. And also, given the fact that menopause is a very natural process that happens in a woman's body, should every woman be considering HRT treatment, or is it very specific to certain women who have certain conditions, or is it a generic thing that everyone can take?
Yeah, it's a natural process. It's an aging process. It occurs to everyone.
Yeah.
It does not happen in a day. It takes years. Perimenopause takes 8 to 10 years, followed by menopause. But as I told you earlier, say they are in the menopause is before the age of 40, early menopause or premenopause. They benefit by taking the therapy. Or if, as I told you earlier, if somebody has got history of colorectal cancers in the family, or if they have a lot of polyps in the colon and rectum, they may benefit by taking this thing. But once again, it depends on what symptoms. If they have intractable symptoms disturbing their lifestyle, disturbing the day-to-day activity, then they should. If minor symptoms, you don't take unless there is a compelling reason to start HRT, like to prevent heart disease, to prevent the bone in early menopause. So it's very interesting, evolving. Our science is evolving. Today is this, tomorrow it may be different.
Something else, yeah. Dr. Shantaram, now coming to our final section. What are some of the measures you would recommend a woman to inculcate in her life to prevent diabetes?
Yeah. So I'm going to say something nice about women now.
Okay.
Mahatma Gandhi ji has said, if you educate a man, you educate a man. But if you educate a woman, you educate a generation. Similarly, the treatment also, if I treat a diabetic man, I'm treating the diabetic man, the individual. When I'm treating a women diabetic, I'm not going to stop with there. It's going to be intergenerational. That is the offsprings.
Generations to come.
Yeah, how they can prevent diabetes. She can prevent diabetes by maintaining her ideal body weight, by regular physical activity, aerobic, anaerobic exercises, muscle strengthening exercises, yoga to de-stress, by following a healthy diet, by establishing a good sleep pattern, by reducing the mental stress through by avoiding or by reducing through meditation and other relaxation techniques. And women can take a hormonal replacement if there is an early menopause, which can help to prevent diabetes if they are prone to develop in the postmenopausal period. This is something specific to women, not to men. Other things apply to everyone.
Yeah.
And much more than that is to prevent a diabetes free generation. Only women can do that because they
Wow.
are producing the intrauterine environment decides whether the newborn is going to develop diabetes, blood pressure, cholesterol, obesity, cardiovascular disease in future. So proper nutrition, the proper control of blood pressure, sugar,
Mm.
and early diagnosis and treatment.
Yeah.
So now there's an entity called gestational diabetes mellitus, which is intergenerational. The intrauterine environment decides whether you're going to overweight baby or underweight baby. Both these sex are prone to develop all the problems what I've enumerated between ideal body weight. Then you have a healthy baby. So uncontrolled diabetes in the early stage of pregnancy produce underweight baby. In the late stages of pregnancy, it can produce overweight baby. So they are going to be potential diabetics, cardiac patients, and all
Oh
those
my.
things. So women play a big role in preventing diabetes not only in herself but also in the society. Now we are going a step forward ahead of this thing. Not even gestation. We want to prevent gestational diabetes.
Hmm.
I told you earlier in my discussion that insulin resistance is the common denominator for the blood pressure, cholesterol, diabetes, and everything. And we want to give a tablet by name metformin, which addresses insulin resistance. So once you cut down the insulin resistance, in metformin, the values are above a certain value, even before the fetal cell recognizes the glucose. That is
Okay.
called the primordial prevention,
Okay.
where we are moving a step ahead to ensure a diabetes-free generation in future.
Wow.
So women has got a big role in this.
Yes, absolutely, Dr. Shantaram. Thank you so much for that, so much of insight into diabetes and what it does to a woman's body and how important it is to control your sugar levels, because it kind of escalates into, the other organs, damaging the other parts of your body as well. Well, I'm just saying it in very layman
Yeah,
terms.
good.
uh, but thank you so much for your
It's
time.
nice interacting. It's my pleasure. Thanks for the opportunity. Thank you.
Thank you,
Thank
doctor.
you.